Okay, Shawana, you can come right in here and take a seat.
Okay.
So my name is Vanessa, and I'm going to be your nurse today. I'll be performing your assessment for you. Before we get started, can you go ahead and verify your name and your date of birth?
Shawana Elijah, 32619.
Okay, and do you have any allergies, Shawana?
No, I don't.
Okay, so I am going to, like I said, do your assessment for you, head to toe assessment, start at the head, work my way down to your feet. Before we get started, do you have any questions for me?
No, I don't.
Okay, so this will take about just 5 minutes. I did assess your gait when you're walking in, so your gait looks normal, your walking is pretty good, and I did your vitals, and your vitals are good, so far everything looks good, okay? No questions, right?
No questions.
Okay, thank you. So I'll go ahead and get started, okay?
Okay.
So like I said, I am going to go ahead and start at top with your head. Your general appearance looks good. So far your skin looks good. From what I can see, that's just exposed.
Okay.
I'm going to go ahead and start with your scalp.
Okay.
Okay, just feeling if there's any bumps or knots or nodules or anything like that. The skin looks good. Any pain or any problems with your scalp recently?
No, everything's been okay.
Okay, good. Really quick, can you go ahead and just squeeze your eyes together and lift your eyebrows really high and smile really hard? And then go ahead and open and stick your tongue out for me. Okay, I'm just going to go ahead and look in your mouth. I'm going to take a look at your tongue, your uvula. Everything looks good. Okay, so you can go ahead and close that. Now I'm just going to take a look at your ears on each side. Make sure they're symmetrical. Everything looks good. Any pain in the ears?
No, my ears are okay.
Okay, good. So just your nose now. Go ahead and close one nasal for me. Okay. And breathe in and out and you're good. And do that on the other side. Go ahead and close one there and you're good. Okay, any problems breathing in or out?
No.
Okay, good. So I'm going to work my way down to your neck now. I'm going to go ahead and I'm just going to go ahead and palpate your cervical lymphatics. Okay, everything looks good. Any pain there?
No, no pain.
Okay, so I'm going to go ahead and I'm going to assess your strength in your head and your neck.
Okay.
So I need you to go ahead and push against my hand. Okay, good. And push against my hand one more time. Good. And I'm going to check your range of motion now. So can you turn your head from side to side, up and down, back and forth? Perfect. And any pain there with that?
No pain.
Okay, good. So one last thing on your neck. I'm just going to go ahead and also take your carotid arteries. I'm listening for a bruit, okay?
Okay.
Okay. Everything looks good there. So now I'm going to work my way down. We're going to go ahead and listen to your heart and your lungs right now, okay?
Okay.
So I'm going to start with your heart. Okay, your heart sounds good. The rhythm is good. It's a regular rhythm. I listened for a minute at your apical pulse. Your rate was 82, so that's pretty good.
Awesome.
So far, I've been assessing your respiratory rate. That looks good too. I did your respiratory rate for a minute and you're at 16, so that's pretty normal too. And you don't have any labored breathing or anything like that. So far everything's looking good, but I am going to go ahead and listen to your lungs right now, okay?
Okay.
Okay, everything sounds good in the front. All your clear in all lobes. I'm gonna go ahead, I'm gonna do the same thing in the back,
Okay.
and I'm listening for 1 inhalation and 1 exhalation, so.
Okay.
Okay, so your lungs sound good, your skin is looking good. I don't see any cyanosis or any blue or anything. And as I just take a look at your fingertips right now, everything looks good. Your nail beds are good. They're not blue, they're normal for your skin ethnicity, they're pink, and I don't notice any clubbing or anything, okay? We're gonna work our way down to the stomach, so I just need you to go ahead and lie this way for me.
Sure.
Okay, so what I'm gonna do is I'm gonna look, listen, and then feel.
Okay.
So I'm just gonna go ahead and look now. I'm looking at your skin and at the circumference. Everything looks good and pretty symmetrical. I don't see anything just from this view that's out of the ordinary. Okay, I don't see any edema, there's no masses, no hernia, umbilicus looks good, no redness, drainage, bruising, brownness, and no surgical scars either. So now I'm going to go ahead and listen. I'm going to listen in all 4 of your quadrants in 1 minute in each quadrant, and I'm checking your vowel sounds.
Okay.
Okay, so I have vowel sounds noted in all 4 quadrants.
Okay.
No hyperactivity noted, and there were no quadrants that didn't have any vowel sounds. Now I'm going to go ahead and palpate, and I'm just basically feeling your abdomen all the way across. Any tenderness? Any pain?
No, no tenderness, no pain.
Okay, and I don't notice any masses either, especially over the liver or spleen, and I can't palpate those, which is normal.
Okay.
Okay, so since I have you laying here, I'm going ahead and double check your arms.
Okay.
From what I can see, also your skin looks normal to ethnicity for your arms. I need you to go ahead and lift your arm for me, please.
Sure.
I'm palpating the axillary lymphatics, also checking your lymph. And next arm.
Okay.
Okay, and it looks good there. You can go ahead and sit back up for me, please.
Sure.
Okay, so now I'm going to assess your strength. So go ahead and grab my 2 fingers and grip them.
Okay.
Okay, good. And that's equal. I'm going to now have you, I'm going to check your range of motion. So go ahead and raise your arms for me, out to the side and back down. Okay, and one more time just out front. Let me double check that. Okay, good. So your range of motion is equal. And now I need you to just grab my hands one more time and pull away from me. And you pull back now. Okay, and go ahead and push my palms. Okay, your strength is equal on both sides as well. Now I'm going to go ahead and check your radial pulses. And they're equal. I'm checking them on both sides. And I'm going to go ahead and, since I have your hands here, I'm going to check your cap refill on both sides. And it is less than 2 seconds. So the last part of this is I'm checking your legs. I am checking your feet and your legs on both sides. And there is no edema noted. And then now I'm just going to go ahead and check your pulses. So I'm checking your pedal pulses. Okay, and your posterior tibial pulses. Okay, good. Go ahead and push down on my hands with your feet and push up. Okay, so I had you flex and dorsiflex, and that strength is equal there. And one last thing, I am going to check your knee reflex. And that's your popliteal reflex. So just go ahead and relax, and I'm just gonna hit right underneath that knee and on both sides, and I see that there's a kick and there's a reflex. Okay, so we're done. everything is looking good.
Okay, good.
Is there anything else you needed to let me know about?
No, that covers it.
Okay, and no pain, right?
No pain.
Okay, great. So thank you. We are all done.
Well, thank you.
And you have a good day, and we'll go ahead and get this together for you, okay?
Thank you very much.
Okay, you have a good day.
Thank you, you too.
Okay.